my name is Rocky. I'll be your student nurse practitioner for today doing your assessment. This video will be uploaded onto YouTube for the course. Is that okay?
Yes.
Okay. So I've already done my HPI and interview. I'll be starting off with the abdominal assessment. So first I'm going to make sure that the patient is properly positioned with supine and legs supported. I'm going to make sure that the abdominal muscles are relaxed. I'll be starting off with my assessment with inspecting the abdominal contour, peristalsis. Abdomen is flat, symmetrical with no peristalsis, movements, or pulsations noted. I'm also inspecting for the sclera or the overall skin of the abdomen, which is consistent with the chest, appropriate for race and age. There's no jaundice, no cyanosis noted, which is a normal finding. Now I'm going to be starting with auscultation. With auscultation, I'm going to be auscultating for the abdomen for bowel sounds, noting for hypoactive, normal active, and hyperactive bowel sounds to all four quadrants, the right lower quadrant, right upper quadrant, moving to the left upper quadrant, left lower quadrant, making sure that I do it for a full minute for assessments. Okay. No more active bowel sacs presence to all four quadrants. After that, I'll be checking the auscultating for the aorta, which splits off to the renal arteries, iliac arteries, as well as the femoral arteries. I'm going to be auscultating for any bruits. So first, the aorta above the umbilicus. Checking for any bruits moving down to the renal arteries, both left and right. And I'm going to check in the right iliac artery and left iliac artery, down to the femoral arteries as well. Okay. After auscultation, I'm going to be moving to percussion. For percussion, I'm noting the patient for any signs and symptoms of distress or discomfort. And could you please let me know if I cause any pain or discomfort
I'll let you know.
during the exam?
Yes.
For percussion, especially for palpation. So I'm going to be taking my two middle fingers in both my left and right hand, and I'm going to be tapping onto the middle finger, noting for tympani and donus. I'm going to first start off with percussing at all four bowel sounds. I'm gonna first be percussing at all four quadrants of the bowels of the abdomen. So I'm gonna start and noting if it's tympani or donus. So noted tympani to all four quadrants of the abdomen. Now I'm gonna be percussing the bladder and noting tympani. I'm gonna pull this down a little bit. Okay, noting tympani to the bladder. The suprapubic region is where I'll be percussing, and which is a normal finding. Dullness may indicate distended bladder. Next one, I'll be percussing the liver for dullness, and I'm also going to be finding the bottom edge of the liver. So I'm going to start off at the mid-clavicular by the umbilicus, percussing my way up. So around this area is where I'm noting the dullness, the change from tympani to dullness, which is the bottom edge of the liver as well. And I'm also gonna be marking this area for as I need it for the measurement of the liver span. So I'm marking this area, and now I'm gonna be percussing down from the third intercostal space down and noting from tympani to dullness. Okay, so around this area by the fifth intercostal space, I noted the dullness, and I'm going to be measuring that area, and it's about 6 centimeters, which is a normal finding. Normally it's about 4 to 6 centimeter. Next one is I'm going to be percussing for the spleen, which is in the posterior mid-axillary and between the 9th and 11th intercostal spaces. So in a clinical setting, I would be on the other side. Okay, no dullness noted, which is a normal finding. Now I'm going to be palpating. I'm going to be palpating, doing a light palpation of the abdomen. Okay, let me know if there's any pain or discomfort. Just doing a light palpation. How was that?
Good.
Okay, now I'm going to be doing a deep palpation of the abdomen. Any changes or
No.
any pain?
No.
No? Okay, now I'm going to be palpating the liver. So around the umbilicus midclavicular line, I'm going to be palpating the liver on inspiration. So I'm going to go ahead and around that area that I marked earlier. Okay, go ahead and take a deep breath. Okay, exhale. Okay, one more time. Deep breath. Okay. And the liver is palpable, which is a normal finding. Now I'm going to be palpating palpating the spleen on inspiration. I'll be palpating diagonally from the right lower quadrant to the left upper quadrant, making sure you take a deep breath as I move my fingers. Okay, deep breath. Good. Exhale. Okay, deep breath. Exhale. Okay, deep breath. Good. Okay, deep breath. And one more deep breath. Good. And the spleen is not palpable, which is a normal finding. After palpating the liver and the spleen on inspiration, I'm going to be doing the special test of the abdomen. I'm going to first start off with the fluid wave test. You're going to have you put your hands together and put it midline, yes, across the stomach. And I'm going to take both my fingers, one to the lateral aspect of the abdomen, and I'm just going to hold it there, and then the other is the finger. I'm going to be flickering or sharply tapping into the other lateral aspect of the abdomen, and normal finding, there would be no fluid or any sensation felt to my finger because there's no fluids shifting to the other aspect of the abdomen. Okay, that's good. Which is a normal finding. It means that it's a negative fluid wave test, and it's a negative for ascites. For people with ascites, if we do that test, there would be a shock of wave of fluids shifting from one side to the other. Next, I'm going to be doing the Murphy sign, which is checking for the acute cholecystitis. I'm gonna be palpating from the right upper quadrant below the costal margin, mid-clavicular line, and I'm gonna have you take a deep breath out. Okay, good, and you put out, good, and take a deep breath in. Good. Okay, out. Is there any pain?
No.
Okay, good. Which is a normal finding, and it's a negative Murphy sign test. A positive test would be a patient experiencing pain during palpation upon inspiration, and this would be indicative of acute cholecystitis. I'm also going to be doing a rebound tenderness test for appendicitis, So I'm gonna go ahead and palpate on the right lower quadrant. Okay, and take it, right lower quadrant, and I'm gonna briskly let go. Okay, was there any pain?
No.
Okay, which is a normal finding, negative for the rebound test, and it's negative for appendicitis. A positive finding or abnormal finding would be as I let go, there would be complaints of pain and discomfort. The other one is the I'm gonna be doing the CVA tenderness test. So I'm gonna have the patient sit up. Okay. I'm gonna be I'm gonna be placing my left hand around the 12th rib, and then I'm gonna go behind him, and I'm gonna take my right hand fist, and I'm gonna thump it onto my left hand right by the kidneys. And as you can see, the patient is experiencing no pain, no discomfort, which is a negative sign for CVA tenderness. There's no CVA tenderness noted. A positive finding or abnormal finding would be as I thump, the patient would complain of pain or tenderness. This concludes our abdominal assessment. Do you have any questions or concerns?
No.
Okay. Thank you very much.